I think there's a lot of population data that suggests aspirin has a beneficial effect across a range of cancer types, but particularly for colorectal cancer. There's a big body of evidence that supports the use of aspirin in high-risk groups, particularly our Lynch syndrome patients. And there's ongoing trial that we're very keen to support. It's a global trial led from Sir John Byrne in Newcastle, looking at varying doses of aspirin in preventing Lynch syndrome cancers in this patient population. So we're going to update the forum about that. We're also interested in potential role of aspirin in the general population, and that's a bit harder to accumulate evidence for. Where the risks of disease are lower, we're a bit more concerned about the likelihood of side effects and all the usual issues with sort of general population, a population who aren't well or have an average risk around adherence, compliance and biomarkers to guide treatment. But through the UK Therapeutic Chemo Prevention Network, we hope to be able to look at reprofiling these existing treatments and issuing some guidelines or position papers on how best to use these drugs. We're very excited, firstly, that these trials, these large-scale global prevention trials, are being done. I think we, already have a good body of evidence to support using aspirin in our high-risk groups. Ideally, we want our patients to be recruited onto those trials so that we can begin to answer some of the questions around dose and schedule and do some of the correlative translational work to understand how these drugs work. Do they work for everybody? And if not, who are the patients in whom they're most likely to work?